To be any age is a gift. But if you're 85 years or older, you're in good company because it's one of the fastest growing groups in the United States. But with increased longevity for seniors comes more responsibilities and stress for family members. Our next guests say there are now more options. Joanne Walsh is the president and CEO of Constellation Health Services, and she's here with her communications assistant, Christine Fitzsimons. Welcome to the both of you.
Thank you.
A lot of the statistics show that 80% of home care for seniors is being provided by family members, and they're feeling a lot of stress. Are you also seeing that?
Oh, definitely, definitely. And there's so many families where it's a sandwich generation situation where you have the adult children working, raising their own children, but then trying to make sure that their parents are well taken care of and are safe in their own homes.
What is Constellation Health Services? What do you provide?
We're a certified home health agency and a private duty agency that also provides geriatric care management.
Christine, we were talking earlier, you field a lot of the phone calls.
I do.
What kind of calls did you get?
Well, obviously every situation is unique, and we treat them as so, but there are some reoccurring themes that I see in fielding these calls. A lot of the times, which Joanne mentioned, there are people in the sandwich generation. They're trying to provide for their elderly parent, whether it's been brought on by a unique health crisis situation or an ongoing concern that they've had, while trying to juggle their own responsibilities, whether it be with their career, taking care of their children, raising their family, and also trying to now provide extra support for their family member. They call in and maybe they've had to take time off work, or they're not sleeping at night. And they've gotten to the point when they call us where they're in crisis panic mode. And our recommendation...
You can hear that panic in their voice?
Oh, absolutely. And what I try and do is reassure them that they're making the right decision by calling us, and we can now get the ball rolling and minimize that stress and plan both short and long term and give them the support that they need.
People shouldn't feel bad about calling in.
Oh, no. Frequently, people don't even have the words. They're not sure what they need. Sometimes people are arguing among one another about what needs to be done, and during that time period, nothing's being done because they can't reach a consensus about how to proceed. And we can help just break it down into manageable steps. Step 1, Step 2, and a lot of times people are amazed that there are resources that we're able to identify for them that they didn't know were out there in the community. Sometimes it's just a small thing that can be put in place that just creates a whole new ballgame and peace of mind and just security for everyone involved. Because everybody wants to take good care of their parents. Everybody's concerned about that. And as Christine says, the sleepless nights are very real.
How do you avoid that crisis mode?
Well, we recommend that you sit down and talk with a geriatric care manager. And that person is a certified, experienced person, knowledgeable about elder care in all aspects in terms of health conditions and health processes, entitlement programs, Medicare, Medicaid, what do they cover, community resources, assisted living, long-term care, nursing homes, really anything that's involved in providing a safe, secure living arrangement for an elder person.
But you really need to be comfortable with the program you choose. Is that right, Christine?
I think so. I think it's a daunting task navigating through the complexities of the healthcare system, and I think that, just taking that first step will make people feel more comfortable, and after talking to somebody that is reliable and you know that you're getting quality care and services for your loved one, that makes them feel like they made the right decision.
Well, a lot of people don't really understand how to really navigate throughout this healthcare system.
Oh, absolutely. And so often something happens, like, someone falls and breaks a hip, or an adult child visits from out of town and visits at the home and realizes that things seem a little bit in disarray, or there's a little bit of beginning forgetfulness or dementia, and these things are very, very concerning and upsetting for people. But again, if you just take the time to be preemptive and start talking about what are the options, most people, the number one option is they want to stay in their own home.
Absolutely. And so what's the number one tip is to plan now?
Plan now. Plan now. Don't put it off.
Absolutely. Thank you so much.
Thank you.
And if you want more information on Constellation Health Services, they are located in Norwalk and in Orange. The phone number is right there on the screen. There's an 800 line, 800-332-1033, or you can come to our website and we'll have that information for you.